Hi, welcome to part 2 of your Healing Channel's description of what's in my hair. Previously the video talked about arteriosclerosis. We touched a little bit about insomnia and dry skin, but I just wanted to break down some more very common symptoms that we're concerned about, things that we're taking a lot of medications for, and things that we can definitely try to use a different way to address these issues. So if I break it down even further, let's talk about osteoarthritis. A lot of patients come to me and they talk about, oh my goodness, the weather's changing and my joints hurt and everything is a mess. I need to go see a rheumatologist and blah, 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 blah. But that's not helping. And potentially I need a hip replacement or something drastic like that. So again, hair tissue analysis can give us so much information as to what is really going on in our system and give us alternative ways in treating it. In the background, the cooing that you hear is my 2-month-old little girl, so she's my background music. So osteoarthritis is high calcium to magnesium. Atherosclerosis is a magnesium deficiency relative to calcium. Calculus formation is actually calcium that's being deposited into the joints, and that would also cause urinary problems and gallstones. So it says when calcium to magnesium ratio is high to relative magnesium ratio. Let's start that again. I can't talk. When the calcium to magnesium ratio is high, a relative magnesium deficiency exists. So when calcium is too high, magnesium is going to be too low. Your body's not absorbing the magnesium because the calcium is in the way. Magnesium is important for normal calcium metabolism. A magnesium deficiency relative to calcium may cause calcium to precipitate out of solution, contributing to calcium depositions in the urinary tract and gallbladder. Vitamin B6 along with magnesium aids in preventing calculus formation as it results of calcinosis. All that means is, number one, please don't go out and go get some B6. The reality is we really need to know what all of your levels represent so we can give you the proper dosages and the proper ratios of supplements to balance things out. Here we have cardiovascular irregularities. An imbalance between normal calcium to magnesium relationship can lead to cardiac irregularities such as arrhythmias, bradycardia, which is a slow heart rate, and tachycardia, which is a fast heart rate. This is usually true if potassium metabolism is disturbed, leading to EKG or ECG abnormalities. Colitis. Anything with the I-T-I-S means inflammation, and colitis is inflammation of the bowel. Calcium and magnesium are necessary in a proper balance for normal muscular function. An elevation of calcium to magnesium is associated with colitis-like conditions. If calcium is elevated relative to magnesium, it may contribute to muscular tension. If that happens in the bowels, guess what? That's called constipation. And what happens when most of us feel there's a need to eliminate and we can't? We get some kind of laxative. A lot of us are now turning to alternatives in terms of herbs, which is senna or cascara sagrada or some other things. But those are temporary fixes, and again, a hair tissue analysis would determine the exact cause of your constipation states. So don't continue to do those over-the-counter things without first finding out where you stand completely as a whole person. Diverticulitis is another one, which is very common in the African American community. Diverticulitis, a disturbance in the normal balance of calcium and magnesium, can result in abnormal muscular contraction and relaxation. The present pattern indicates a possible disturbance in intestinal mobility and inflammation. This may be associated with some form of intestinal disturbance, such as diverticulosis. So what this report is telling me is, because of the calcium-magnesium balance, again, there's potentially going to be some bowel issues, and that would mean intestinal mobility, meaning your intestines can't do that peristalsis motion that helps pass the waste through your body. It sort of can't do much because there's a muscular thing going on. And inflammation is a swelling. So you have a slowing down and a swelling, and then you have misery. That's what you call it. Dry skin and elevated calcium. Excess calcium can cause a loss of cell fluid content or dehydration, thereby contributing dry skin. So it's interesting that drinking the proper amounts of water and drinking the proper content of water, and we'll get into that another day, can have a significant effect on whether your skin is dry. So for those of us who love Bath & Body Works products and other skin emollients that we get over the counter that smell good, they're only going to temporarily address the issue. The root cause of the problem is what we need to get into, and the root cause is usually calcium. Very interesting. Hypercholesterolemia. What that means is high cholesterol. A lot of people believe that cholesterol has a lot to do with what you eat. Promise margarine instead of butter, yada, yada, yada. The truth about the high cholesteremia is that is usually caused by copper deficiency. And also high stress will cause cholesterol levels to go up really high. And this particular patient, it says the patient has elevated zinc to copper ratio. This relationship found in a serum is associated with increased instances of atherosclerosis. It says caution should be taken with the amount of vitamin C intake. Vitamin C intake with the low serum copper and zinc ratio has produced hypercholesteremia. So what that means is, if you're arbitrarily just taking vitamin C because you think it's a great antioxidant for warding off colds during the winter season, you might want to rethink that, because if you have a low copper to zinc ratio, you're going to elevate the production of cholesterol in your system, which in turn could cause other problems. So again, I hate to just keep beating on the idea that natural medicine is a cure-all. It is not. However, natural medicine really can help you get to the root cause of your issues so you can find alternative ways to handle them instead of taking medications. Natural medicine is a very viable source of preventive care. You get a chance to get an overview of your whole body at one time. You don't need to see an ears, nose, and throat specialist. You don't need to see a cardiologist. You do, but when natural medicine takes place, you get an overview of everything that's going on with your body. So at that point, if you still feel the need to go check out a specialist, then you have much more information in hand to be able to tell you who you need to see. Normally, lab reports will come back and they will tell you exactly what regimen of supplements that need to be taken in order to address the imbalances. And what will happen is those symptoms will regress and you will start feeling a lot better. And what happens is your body will start healing itself. Isn't that wonderful? So, the other ones I wanted to go over was osteoporosis. Even though high tissue calcium is present in a low metabolic person, osteoporosis is at a potential risk. And the reason is because calcium is not being absorbed by the bone. It's just hanging around and it's being absorbed in other places. And if the calcium is not going where it's supposed to go, in the bone, then you're going to have some osteoporosis systems. I have a quick story about my mom. My mom was taking a prescribed medication for osteoporosis. She got a bone density scan done, and everything led to the fact that she needed a calcium medication for that. I did a hair tissue analysis on my mom because, of course, I'm going to take care of my mom, and it determined that my mom's calcium levels were low, even though she was taking a prescribed medication for that issue. The reality is she had a tin toxicity, and the tin was binding the calcium. So even though she was taking calcium, there was no calcium absorption going on, and she still ran the risk of osteoporosis in her bones, bone porosity, and potentially brittle bones, which will cause breaking and then her falling. So I'm glad we caught that, Mom. I love you. Back to our report. Another great aspect of the hair tissue analysis is it tells you what dietary recommendations are good for you based on your metabolic type. Most people don't eat enough protein, and protein is the building blocks of all of our cells. A lack of protein will also cause
you to be bald. Lack of protein also causes a lot of other problems. So your hair tissue analysis will break down specifically what your diet should look like based on your metabolic type. And then the answer to the question that most people are asking me, how do you fix all this stuff? It's very simple. Well, actually, it's not simple. The concept is very simple, but compliance is the key. When a hair tissue analysis report comes back from the lab also sends with it recommendations for supplementation, let me get you in there, that needs to take place in order for it to be balanced. And these same supplements are obtained in the office. Now, it looks like a particular person is taking 1, 2, 3, 4, 5, 6, 7 supplements. And she's taking them in different ratios, different variations, 3 times a day. If I look at her report, it'll tell me the reevaluation date should be in 90 days. But will this person have to take all this stuff forever? No. The beauty of natural medicine is you're going to be only taking this until the body starts reacting and rebalancing itself. What will happen, all of those tendencies that you saw will start going away. And I will show you a report in the next segment of tendencies that are minimizing or going away completely as a result of rebalancing the body. So, this is Dr. Reed signing off, your healing channel, a natural medicine practice here in Baltimore, Maryland, that we love to be able to service all of our community so we can all be healthy and share in the wealth of information that natural medicine provides. Until next time, be well.